My name is Dr. Jessica Rabon, and I'm a pediatric psychologist. I am originally from Massachusetts, but I moved down to South Carolina in 2007 when I started at Furman University, and I have a PhD in clinical psychology with a specific focus in pediatric psychology. So I chose psychology because I have always been interested in the intersection between physical and mental health, as well as the development of children and adolescents. And I specifically chose to work with children and adolescents because of that interest, and I feel like I can make the most impact working with that population. I love working in a hospital setting because there is so much variety of the patients I see, the presenting problems, and I also really like working on an interdisciplinary team with people from all different types of disciplines. So within pediatric psychology, I focus on complex medical disorders in children, as well as depression, anxiety, and then LGBTQ-related problems, issues, and care. I work from an evidence-based practice, particularly in the realm of cognitive behavioral therapy. However, I also recognize that each patient and client is unique, so I try to meet their needs. Also, I feel like it's really important when you're working with children and adolescents to be professional yet relatable, because you have to build that trust. I chose Prisma Health because I love the Greenville area. My husband's originally from Greenville. I went to Furman University as an undergrad. So after graduate school, our goal was always to move back to this area. I interviewed for my fellowship here, knew I wanted to finish out my training here, and then was lucky enough to get a staff psychologist position. Outside of healthcare, my interests are exercise, spending time with my family, friends, and dog. I really like music, and I also really like crafting. The advice I give to my patients that they find most valuable is go at your own pace, especially when it comes to the therapeutic relationship. It can be very difficult to open up to somebody the first time. So share what you feel comfortable sharing, and as we build the relationship and trust, then it's okay to share more things. You do not have to share everything on the first session.